Hello, my name's Jan Douglas. I'm a PhD student at James Cook University and I'm raising money for my research project, which is into a disabling and disfiguring disease called elephantiasis. Elephantiasis, or lymphedema as we would call it in Australia, is caused by a problem with the lymph system. And in developed countries, this usually happens after treatment for cancers such as breast cancer, which can result in a swollen arm. But the biggest cause of elephantiasis worldwide is a mosquito-transmitted worm called lymphatic filariasis. The mature worms live in the lymph vessels, where they can cause elephantiasis of the legs, arms or breasts, and in males, hydrocele, which is a swelling of the scrotum. Lymphatic filariasis, or LF for short, mostly occurs in developing countries among subsistence farming communities. These are the poorest of the poor, sometimes referred to as the bottom billion. There are so many people affected by LF in these countries that it is the second greatest cause of physical disability globally. About 40 million people already have chronic disease, and 120 million people are infected and therefore at risk. And about 1.4 billion people, that's 1/7 of the world's population, live in LF endemic areas where they're at risk of becoming infected. My research project will investigate what factors drive the progression from infection to disabling disease. We know that children can become infected with LF, but usually won't develop symptoms until they're adolescents or young adults. And not everyone develops problems. This is true in cancer patients too. But we know from our experience here that lymphedema can sometimes be prevented if we intervene early enough. So expect it will be the same with LF. But who needs the intervention, and which interventions are best? I'm going to try and answer some of these questions by taking physical and biochemical measures of children and adolescents living in an LF endemic area in Myanmar. What we find out here may also benefit young people in other LF endemic countries, such as India, Bangladesh or Africa. I already have in principle approval from the Myanmar Ministry of Health, and I've got a great advisory team, experts in parasitology and lymphology. The first step will be to identify who is infected, so we'll use these ICT cards. They're a single-use, rapid diagnostic test using a drop of blood from a finger prick to determine if any LF infection is present. The cards are only about $10 each, but we're going to need around 2,000 of them. And that's just the beginning. We'll need to take repeated measures over time and have them processed by some fairly expensive laboratory procedures. You can help me achieve this goal of determining who's most at risk by choosing one of the gifts you see on the Rocket Hub site. To donate, simply select a gift or enter a custom amount, keeping in mind that this is in US dollars. Or if you would like me to send you one of these beautifully printed gift cards and a certificate to give someone as a present, then select one of the cards and the gift and supply your postal address. Each gift represents a necessary aspect of the study, and as much as possible we'll use local resources and personnel so that the Myanmar people can continue with the program after the study's been completed. Please help me find a way to help these young people. Any contribution that you can make will be greatly appreciated, and all monies collected will go towards the project. Thank you for watching this video, and thank you for supporting the project. Please do forward this link to anyone that you think might be interested. Jesu Din Bate.